Hey everybody, this is Dr. Nick with the Springfield Wellness Center, and this week we're going to be talking about shin splints. So shin splints are a condition that a lot of runners deal with. It's an overuse injury, so a lot of long distance runners seem to deal with those. They can be caused by a couple of different things, but the main ones are going to be a lack of support in the arch of the feet or flat feet, also instability in the core or in the hips. Another thing that can cause that is if you're running on really hard surfaces or uneven surfaces and causing more stress on one leg than the other. So what shin splints are basically micro tears in either the muscle of the lower leg, or it can actually start to be micro fractures in the tibia bone, which is the lower bone in the leg. So rest and ice and stretching are going to be the three things to do once you have gotten shin splints, but what we want to try to do is avoid them altogether. So one thing that we're going to talk about today is going to be orthotics for your shoes, which Dr. Rob is going to come in and tell us a little bit about. He actually does custom-made orthotics here in the office. But the things that you can do, and another thing that you can do before you get the shin splints is to make sure that your core is strong and that your low back is functioning the way it should. So here in the office, obviously, we're going to be adjusting the low back and giving you some exercises that you can be doing at home to help strengthen up your hips and your core to stabilize that area to keep you from getting those shin splints in the first place. If you do end up with shin splints, one of the top therapies that we have here in the office to help with those is going to be our deep tissue laser. So the deep tissue laser, and I'll just show you kind of on my leg, but on the deep tissue laser, and obviously this would be skin on skin, but basically we're just going to run over the area that's giving you pain, and we're going to try to help heal those muscles a little bit quicker than they would on their own. So this actually uses light, gets down to the cellular level, so it helps stimulate that healing at a faster rate than, say, something like ultrasound that would tend to heat up the tissue. So this is a really good therapy if you already have that. So next we're going to talk to Dr. Rob about our custom-made orthotics in the office and how he does those and how those help. So if you're already dealing with shin splints and you want to keep training and keep getting some cardio activity in, the Alter-G treadmill would be a great piece of equipment to consider. The Alter-G treadmill is actually, it's a regular treadmill that can take away up to 80% of your body weight. So a lot of athletes that run professionally use the Alter-G to get a lot of miles in without putting as much wear and tear on their bodies, especially marathon runners. So the way this works is what you do is you get these shorts, and these shorts and you go into this bubble, and they zip in and it creates a seal. And what happens is there's a machine that pumps air into the bubble, and it can take away anywhere from 0% up to 80% of the body weight. So the reason why that's important is because if you are dealing with shin splints, obviously it's the wear and tear of running, and it's causing irritation into the bone and the muscles. Well, if we can take away, say, 50% of your body weight, and you weigh 200 pounds, you are running at only causing 100 pounds worth of pressure on your legs. So this is going to be a really good piece of equipment to utilize if you're trying to continue training while trying to heal the shin splints, because the best thing for shin splints is going to be rest. But if you aren't able to wait it out for the 6 weeks or 8 weeks that it takes to heal, then this is a good alternative. Ready? Yeah. All right. So we're back here with Dr. Rob. We talked a little bit about the custom-made orthotics that we do here in the office, and he's the person that does those for us here. So Dr. Rob, if you could kind of walk us through, number one, what is it that we do to create these, and then how are those going to help somebody with shin splints?
Okay, so this is our basic orthotic blank, and what we would do, we heat this, have the person stand in this foam. So when you're standing in the foam, it's going to take a pretty good mold of your foot. We might have to move it around just to make sure we get everything with the foot. But after that, the person steps off, it will be just a copy of the bottom of their foot.
So basically it'll look something
kind of like that on the top. Now,
where it's supporting their arch specifically as opposed to just a generic
Yeah.
Right. Okay.
So then after that, we're going to take this piece of cork and we'll just glue that on there. which will end up looking something like this. After we have the cork on there and everything's dry, we'll grind that down so that we can have the arch in the foot. So that way the foot's just going to be supported in any position.
Okay. Now with shin splints, how is that going to help to avoid, especially somebody like that's a runner that's dealt with them in the past, how can this help to avoid that in the future?
The major thing these are going to help with is it's going to give you some cushion, going to absorb some of the shock. So you're not taking the shock and putting it all the way up the kinetic chain. It's just going to, when you're not putting as much up the leg, we're not going to have as many tight muscles here, which will not affect the knee as much, not affect the hip as much, things like that. So the big thing we're looking for is just cushion and support.
Okay, great. So Dr. Rob can do those here in the office. We actually create them from start to finish. So if you do have any questions about orthotics, especially custom-made orthotics, give us a call at the office and he can answer any questions for you. Next, we're going to talk about the Alter G treadmill and something that you can do if you're actually dealing with shin splints and you still want to train.
And the extension of the spine will help bring oxygen. Shin splints are overuse injury, often seen in runners who perhaps increase mileage too quickly or change terrain abruptly. Runners or walkers doing distance, so this is not an uncommon thing. But what can compound it is often perhaps lack of flexibility at the ankle, over-pronation of the foot or ankle where the arch falls, or over supination where the foot is often striking the ground on the outside edge of the foot. And then just overall lack of flexibility in the ankle can also cause or compound the incidence of shin splints where you're having pain along the tibia of your lower leg. And there's some easy things you can do to prevent it or even help overcome it when it strikes you. The first one we want to do is actually improve the flexibility of the lower leg and the ankle. We're going to get up and do a standing calf stretch first. And the largest muscle in your lower leg, your gastrocnemius muscle, needs to stay stretched and flexible. And we want to do that by just pressing the heel down at a wall stretch, putting the front foot forward. We're going to stretch the back calf muscle, press the heel down, and just kind of lean into the front knee, causing stretch in the back leg. And we're going to hold that for about 30 seconds. And we're going to do it on each leg for about 3 times. So we want to, again, do both legs, stretch both calf muscles. If that's not a deep enough stretch for you, you can always go to a step and do a heel drop to stretch the calf muscle a little deeper if it's something that you need to stretch more deeply. So that's the first stretch that everybody should be doing. The second one is to get the deeper muscle underneath the gastrocnemius muscle stretch, and that's called the soleus muscle. So we want to stretch that muscle as well. And again, we're going to set up similarly to the calf stretch, but we're going to bend the knee. And we're going to kind of sink into that knee while we keep the heel down, and that's going to get to that deeper muscle because we need to stretch that soleus muscle as well. If your gastroc tight, probably your soleus is tight, so we want to do both of those. And it's just a matter of bending the knee as we, again, hold that for 30 seconds on each leg, do that 3 times on each leg. The tougher muscle to stretch is the area that's actually irritated. The anterior tibialis muscle on the front side of the leg is really kind of hard to get to for a lot of people, particularly you probably already got tight ankles, not very flexible, but we can try. And a good way to do is just to get down on the floor, be on your knees, curl your toes so that the ankles are going to be towards the floor. And again, a lot of people with issues with their shins often have very tight ankles, so maybe you won't quite find that flexibility, but that's what we're going to work on. And if you practice it, it will get better. So we want to keep the top of the feet down, and as tolerated, you can sit back on your heels. It's as simple as, for most people, sitting back on the heels or finding some level. Maybe you can't sit back all the way, but you can certainly lean back into that, holding onto a chair or the couch, and eventually maybe being able to sit back to stretch the front side of the leg or the shin area. So that's the 3 stretches that are key to improving the flexibility at the ankle and in the lower leg. Then, of course, we can always strengthen. And people, again, kind of ignore these little exercises, but they can be very effective. You can do either standing or sitting toe raises. And it's just a matter of raising the toe up off the floor, holding it for a second or two, and bringing it back down. 10 to 20 times is tolerated. Particularly if you have any pain currently, you may not want to do these yet, or you might just want to do a few just to get those muscles moving and maybe work out some of the any fluid that's built up there. But as you build strength, you can do more sets. In fact, if you get really ambitious, you can maybe make the alphabet with your foot on each leg, taking time to do each letter of the alphabet, to move that ankle, to use the muscles there that might be weak. That's another suggestion to add to the toe raises. Then of course we'll want to strengthen the calf muscles as well. Again, standing, you can use a wall, just stand by the wall or a chair, lift heels and lower heels. Again, I would start with, particularly if you have any irritation in your lower legs, start with both feet on the ground. After that becomes easier, you'll want to do one leg calf raises to increase the resistance. And again, making sure that you do it even on both sides. Again, I'd suggest 10 reps for both feet, 10 reps on each leg. And again, you can build the progression there by increasing resistance by going to a step, just like we did in the stretches, where you get a bigger range of motion on the heel and the calf raise. And that's going to build gradual strength in that lower leg to help you prevent shin splints in the first place from occurring. But then as you try to recover from that after you've rested and the irritation's gone away, you want to add the strengthening exercises as well. So do your stretches, do your strengthening, and avoid shin splints. If you found this information helpful, please share it with your friends. This is Nancy Thompson, your functional fitness specialist at the Springfield Wellness Center.